Preventing antimicrobial resistance. What is antimicrobial resistance? First, let's break down the words. Anti is against. Microbial is small microorganisms. Resistance is to fight or block. Antimicrobial resistance is a fight against small microorganisms. This is when microbes learn to adapt and build up a resistance against antimicrobial agents such as antibiotics. Although these agents used to be an effective way to fight against harmful microbes, they have become ineffective. When does this happen? Antimicrobial resistance occurs when microorganisms such as bacteria, viruses, fungi, and parasites build up and fight against medications that are used to cure them. These strong microorganisms are referred to as superbugs. This can be dangerous for 3 reasons. It makes infections hard to get rid of, many people die from these infections, and it slowly makes antibiotics ineffective, making years of research and studies outdated. How does this happen? Mutations in natural selection are a way a bacteria can become resistant to antibiotics.
Horizontal gene transfer makes transferring antibiotic-resistant genes easy, helping bacteria become resistant to these medications, making them harder to treat and dangerous to our communities. This presentation will discuss how the antimicrobial resistance crisis, or AMR crisis, has been associated with the overuse and misuse of antibiotics, inadequate hand hygiene, improper disposal of medication, and the importance of vaccination. So, how are antibiotics misused, and what can we do to help? The overuse of antibiotics is prevalent across the globe. Antibiotics are easily accessible through pharmacies and health centers, where they are prescribed much too often. These antibiotics are prescribed very quickly, usually prescribed before receiving test results back to determine an effective treatment plan related to that person's diagnosis. Taking antibiotics when unnecessary exposes microbes to these treatments, allowing the resistance to grow and become stronger, adding to the antimicrobial resistance crisis, creating these superbugs.
Solution number 1, hand hygiene.
Beyond the basic explanation of washing our hands, hand hygiene is also a very important part of preventing antimicrobial resistance. When we clean our hands with soap and water, we remove dangerous microbes while also maintaining the normal microbiota of our skin, helping to prevent sickness. When we prevent sickness, we reduce the amount of antibiotics that may have been needed to treat an illness, reducing the occurrence of antimicrobial resistance. Research done by the Centers for Disease Control and Prevention has shown that by washing your hands, the risk of contracting a respiratory illness such as cold is reduced in the general population by 16 to 21%. Hand hygiene is a basic necessity of our everyday lives. We are taught from a young age to wash our hands with soap and warm water for at least 20 seconds, especially after we have gone to the bathroom. Washing our hands removes dirt and germs from our skin to help keep ourselves healthy. By not washing our hands, we can spread germs from our hands to any surface we touch, including our own eyes, nose, and mouth. The small amount of time it takes to wash your hands helps to keep your entire community healthy. The process of hand washing works through the common protocol of degerming, which is when the microbial load on skin or tissues is reduced through gentle to firm scrubbing by using a mild chemical.
Demonstration on why hand hygiene is important. The pepper symbolizes bad microbes on our hands. I have soap on my hand and is going to represent and show how soap gets rid of bad microbes that can cause us to get sick. When I put my hand in the water, the pepper will repel to the sides of the bowl, representing how soap gets rid of bad microbes on our hands. Without proper hand hygiene, these microbes, represented by the pepper, stay on our hands and can transfer to other people and make them sick. Washing our hands prevents us from getting sick and acquiring infection. Using this as the first line of defense prevents us from getting sick and having to use antibiotics. It is important for us to wash our hands before eating meals, after using the washroom, and before and after visiting someone who's sick. Using proper hand hygiene will get rid of bad bacteria and prevent us from passing microbes on to someone else.
Solution number 2, proper disposal of medications.
Most medication users are unaware of proper disposal methods, therefore they flush or throw away unwanted and expired medicines. This inappropriate disposal leads to many issues when medications end up in places that they shouldn't be, for example, landfills, water supplies, and drains. The exposure of these environments to these medications leads to contamination of the environment and may expose us to harmful toxins. The improper disposal of leftover, unused, and expired antibiotics is a potential driver of antimicrobial resistance. Many individuals claim that they are not disposing of these medications properly because it is costly and time-consuming. However, it is crucial to make sure that these medicines are appropriately disposed of so that they don't get into the environment and provide certain microbes with the opportunity to build up a resistance against them. Understanding and following the procedures for proper disposal of medications can help fight antimicrobial resistance.
When a person has access to a medication that's no longer needed, it should be disposed of properly to prevent unnecessary and harmful use. There are safe ways of disposing unneeded medications. Drug take-back locations are a safe and easy way to dispose of drugs, and it's also very simple. Pharmacies and police stations are both examples of locations that commonly have drug take-back stations. So a drug take-back station is just a box in which unneeded drugs are put into to be properly disposed of. If there are no drug take-back stations near you, medications can be cautiously disposed of in the garbage. So there is a process to this, including removing the medication from the original container. You need to scratch out any information on the container's label and then hide the medication in something unappealing. So you can use coffee grounds or dirt. So you then put the unappealing trash inside a zipper sealing bag and hide the medication inside of that bag. This makes the drug less attractive to pets, children, and anybody that'll come into contact with the medication that's being disposed of. Do not flush antibiotics down the toilet, as this can potentially contaminate our environment and have a negative effect on us.
Solution number 3, staying up to date on your vaccinations.
What are vaccines? Vaccines, also referred to as immunizations, work by training the immune system to find and protect against little invaders called pathogens. Pathogens can cause infection and disease, so it's important to get vaccines like the flu shot. The flu shot is an immunization you get once a year to prevent influenza. With the use of vaccines, you are more protected and not as susceptible to the pathogens, so it's basically a shield for infectious agents. And why are vaccines important in antimicrobial resistance? Vaccines can lower the need for antimicrobial use and reduce misuse of antibiotics. Some vaccines also have the ability to directly target antibiotic-resistant microorganisms. By reducing the growth of resistant serotypes, a microorganism that has strains of the same species of bacteria can also reduce the infection rate of closely related species. Furthermore, the effects of vaccines can also enhance herd immunity to protect some people who have not been vaccinated. And what is herd immunity, you ask? Well, herd immunity means if there's a small population of people who are susceptible to infection and are unvaccinated, they are protected because there are people around them who are vaccinated. This makes the unvaccinated people less exposed to the scary pathogens.
Antimicrobial resistance is an important factor to consider as it fights against medications used to cure viruses, parasites, bacteria, and fungi, along with causing ineffective antibiotics. Infections can become difficult to cure, resulting in death due to antimicrobial resistance. Horizontal gene transfer is when genes are moving between asexual organisms by using the 3 mechanisms: conjunction, transformation, and transduction. Antibiotic-resistant genes can be transferred easily through horizontal gene transfer, which then causes medication to become non-effective against bacteria.
As highlighted in our video, the proper use of antibiotics, the implementation of proper hand hygiene, proper medication disposal, and receiving vaccines are all steps we can take to ensure that we are contributing to preventing the occurrence of antimicrobial resistance. It is our hopes that after watching this video, you not only learned something new about the topic of antimicrobial resistance, but that you too plan on implementing these steps into your daily life in order to help prevent antimicrobial resistance. Remember these solutions to stop the spread and help put our antimicrobial resistance issues to bed.
This video is brought to you by VideoScribe. We just want to say a quick shout out to all of our team members. First, Cameron, creator, writer, and researcher. Cassidy, creator, editor, writer, and producer. Emily, creator, editor, writer, and director. Halsey, creator, writer, and researcher. Heather, creator, writer, and researcher. Jenna, creator, writer, and researcher. Jocelyn, creator, writer, and researcher. Keisha, creator, writer, and researcher. Taylor, creator, writer, and researcher. Shelby, creator, writer, and researcher. Thank you to everyone for watching our video.